All right, welcome back, everybody. I'm Chris Wilson here with 7 Minutes for Seniors with Jennifer Schwarz from Senior Helpers. We're into the second segment now. We're going to dive a little bit deeper about senior helpers. What specific things does senior helpers help seniors with?
So we're able to help seniors who have Alzheimer's and dementia, and our caregivers are trained to support those living with Parkinson's.
Okay.
So we make sure that they have all of the normal certifications that they have to be an in-home caregiver, but we really focus on chronic care. These chronic diseases require special attention, and if you don't know, you don't know.
Right.
And so we ask questions during the assessment regarding their health conditions, because if you have someone with high blood pressure that doesn't monitor their blood pressure and their answer is, oh, I feel dizzy and I'm going to lay down, that's going to potentially turn into a stroke. That's a hospitalization.
Yeah, exactly.
So if we're helping them monitor their blood pressure and getting those readings to the doctor, it gives them better care and it allows them to stay home and keeps them out of the hospital.
Right.
So we focus on what their conditions are and how we can support them. So our diabetic clients, we're helping them with their nutrition. We're cueing them to take their blood sugars and reminding them to do their medications.
Right.
And that's in addition to all the personal care needs that people have. So if someone needs assistance with the shower, we can assist with the shower. If they need assistance getting dressed, and that's something as simple as compression stockings being put on.
Oh, God, those things.
It's like you're wrestling. So the caregivers can help with that. And then that senior's not left struggling for breath, bending over for too long, getting pinched skin because they didn't get them on right, or they leave them on for so long because they can't wrestle them off.
Yeah.
Because we see people get them on and then they don't take them off because they can't get them off.
Right.
And that's going to cause more issue than help. So those are some of the things.
Have you ever seen the shaving powder trick?
Yes.
Yeah, we take the shaving powder and go against and then
you put it on.
Right up. Yeah.
I had a lady who had us put them on with gardening hoses because the gloves from gardening had good grip.
Oh yeah.
So she would have us like put them inside out. And she's like, "Get your gloves."
Yeah.
And we would get our gardening gloves to put on our tennos.
I always love, like, especially working with patients like I did. It was always like trying to solve problems, right?
Exactly.
So I did want to ask, like, one of the things that comes up is sometimes people might be unable to test their blood sugar, like prick their finger or give themselves insulin. Are your caregivers able to do that?
We're not able to do that.
Okay.
That's administration of medications. So we can't do finger sticks. We can't do blood draws. We're not able to cut fingernails.
Okay.
Anything that's going to be invasive, we're not able to do. Yeah.
Huh. Okay.
Yeah. So no administration of anything. So we can do medication reminders, but we can't administer anything.
You can't like throw them in their mouth or whatever.
So we can go, it's time to take your medicine. Yeah. Your medicine's over here. And then they have to be able to do it. Yeah.
Huh. Okay. So who would you refer to in a case like that? So it would have to be a nurse?
It would have to be a nurse.
Okay. All right. So then that would be another agency that would have to come in.
Yeah.
Yeah. All right.
Or what we do is we partner with the families and we go in at a time that supports that senior, but the family's there to do the medication portion or the administration of medications.
Yeah. Okay. Now, how do you guys get paid for your services?
So it's typically private duty. It's private pay. We also accept long-term care insurances. So John Hancock, Unum, New York Life, MetLife, those are policies that people have purchased years ago, have been paying their premiums, and then they activate the plan when they need care at home. We're also registered as a VA provider. So if it's a veteran who needs care, we're able to point that veteran to the VA to get hours assigned to them for their care. And the VA has two separate programs for that. They have a Homemaker Companion HHA program, and then they have a Respite program that gives additional hours if that veteran's living in home with a spouse or children. It then gives hours so that family can take a break. Awesome. And not have to be worried for that veteran.
And I want to make sure that you're going to share that information with me. You'll see right about now the link for the things that she was just talking about at the bottom of your screen. So feel free to check those out. They'll also be in the comments so you can find those resources. I'm a veteran. She's essentially a veteran.
Yeah. I'm a support staff for the veteran, daughter and spouse, and I worked with TRICARE for years overseas. So like the goal is to support our veterans in this community, to support any senior that needs to stay home safe. But I have a special place for my vets.
Yeah, absolutely. Absolutely. Now, who is your ideal client?
So my ideal client is someone who wishes to remain home, but is starting to struggle with independence. They're having difficulty maybe getting the nutrition that they need because they're too tired to cook their meals. If you start not showering because you're scared you're going to fall, that's someone we can help. If you're finding that you're not as well rested because you're continuing to worry about your parents living at home, that's someone that should have a conversation with me. It's really hard to be a child of a parent who's aging in place and not know what resources are here for you. And I'm happy to connect you with those resources. Even if it's not senior helpers that helps you, we're going to find the support that you need.
Yeah, like we were talking about earlier, there's a lot of agencies, and they all have their, the things that they do better than the other one.
Yes.
It's not that the other agency is bad; they just do something a little bit different.
Yeah, exactly.
And you, I mean, you're everywhere I'm at, plus all the places I'm not at.
Yeah.
It's like you're ubiquitous. You're everywhere.
I want to
and
be
and
everywhere.
yeah, and the people, in your field that you can refer to if you can't help that client. And that's why I appreciate you guys, because you're not like a multi-tool, and we can do everything.
No.
You know where your limitations are. I know where my limitations are, and then we can move them along to the next best option.
Exactly.
In the community that's going to help them, because our ultimate goal is to keep them safe and keep them out of the hospital.
Exactly. We don't want to go to the hospital. You ask any senior if they like the hospital, they're going to tell you no.
No.
They don't want to go. So
No.
let's figure out a way to keep them safe.
No, you have to be almost dead to go to the hospital, and then they put a bandage on it and send you back home.
And then you better hope you have someone there advocating for you.
All right. So please share with everybody at home how they can get in contact with you, your website, phone number, pertinent details, everything like that.
So my name is Jennifer Schwarz, seniorhelpers.com/West Jacksonville. The main number is 904-779-5515. We have an answering service that answers 24 hours a day, 7 days a week. So if you have questions or concerns, please don't hesitate to reach out to us. We're happy to help.